Hi everyone, this is first and foremost a video regarding the result of my last video, as well as I'll speak about what my consultant said to me yesterday at my renal appointment. So first and foremost, thank you everyone for sharing that video far and wide for me. I can't tell you how far that ended up going. I'm still getting messages today about it. I've had other people say, oh my god, I've got them symptoms, I've been putting it off, or I've already gone to the GP about those symptoms and he hasn't done my bloods either, or things along those lines. But then on the flip coin, I've had allied health professionals as well as medical professionals, doctors, nurses, physios, people saying, oh my god, I would have never thought kidney with your symptoms. And it really made me think now in my practice about how I should maybe order some urea and electrolyte tests. That's Usenees, we call them in GPs and hospitals, and how such a cheap test could show you how someone's kidneys function. And lots of people would never associate headaches with CKD, and that's kind of what I wanted to highlight in my last video, how stereotypical symptoms that are often associated with something else can be mistook. So thank you for everyone. I'm really glad it was educational. So the next part of the video I wanted to talk about is my appointment yesterday with my renal consultant. He does know I'm doing these videos and he also thinks it's great, but I'd rather keep things like who my actual consultant is private. But we discussed in depth yesterday. It was quite an emotive appointment for me yesterday. We have been doing my bloods every month since January time, and what we've been doing is we've been waiting and looking to see if we can see a common trend in my creatinine levels. So these are the levels in which we measure how well the kidneys are functioning. It's quite a difficult test because there's so many different things that can affect the creatinine levels temporarily. One of those things was one of the drugs that they put me on. So the biggest battle we've had from the start is trying to manage my blood pressure, because it just does not take lightly to medications. It's almost medication resistant almost. It doesn't, the systolic, so the top number comes down, but the diastolic number at the bottom, which is the continuous pressure when the heart's at rest, is really not budging. So we've been on a load of different medications, endless side effects, but we finally settled on losartan because I got the least side effects with that. But I'm at the top dose of that, the top dose of my amlodipine now as well, which I take alongside that, and my blood pressure, it just is not budging. So this is his concern as well as my concern. Obviously this puts excessive strain on the heart as well as all my other organs in my body, puts you at more of a stroke risk, various different things really. So we've added bisoprolol to that. So I take now losartan, potassium, amlodipine and bisoprolol. We'll add in that, the smaller dose, and then we're going to titrate me up to see if that helps. If not, I might have to go in for some blood pressure monitoring to try and see what the issue is, but we are really struggling with it and he's a little bit annoyed that it's not coming down. So the other thing that we spoke about is how we've seen this trend that my creatinine levels are going up on average between 20 and 30 millimoles. So my creatinine levels started when I was diagnosed at around, I think, 170 or something along those lines. The normal range is 50 to 110 millimoles. That's a normal range. When I was tested 4 years ago for my kidney function for a different reason, my creatinine levels were 77, which is how we know that there was nothing wrong with my kidneys 4 years ago. So what are my creatinine levels now? Well, since then they've been climbing, like I say, 20 to 30 millimoles a month, and I'm now sitting over 300. This puts my kidney function down to around the 16% mark, which isn't great. And prior to this appointment, we thought that the creatinine levels might have been temporarily raised from the drug losartan, because what it does is it decreases inflammation in the kidney, which my kidneys are obviously, I've got the nephritis, so very inflamed, as well as the IgA nephropathy, which then causes obviously the cells to congregate in my kidneys, which is destroying all my small filters, on top of a blood pressure problem, which is damaging my kidneys more. We thought that the creatinine levels, fingers crossed, were slightly elevated temporarily because of how this drug I take, losartan, acts in the body. So it protects the kidney and reduces inflammation, but then temporarily sometimes can rise that creatinine level, and that's the level obviously we measure the kidneys with. And after yesterday's blood results, it's become quite clear to myself and my consultant that these levels are not temporarily raised, and I am sadly making that slow progression. You never know, they might just stop one day and keep me at what I'm at and might just stay there for a while, but it's just not looking likely because of the trend of watching it go down every month. I've lost 17% in 9 months, and I haven't got another 17% to lose. So we have made the decision yesterday that we are going to start testing for my kidney transplant donors. I'm very, very fortunate that I have 4 or 5 donors that are willing to come forward to be tested. I can't even tell you how grateful I am that I have that ability to have those donors tested. However, we need to be mindful that I might not match any of them. However, there is such thing called a paired scheme, where if one of my donors doesn't match me but matches someone on the register, and the person on the register also has a person that would willing to donate but didn't match them, but their kidney matches mine, we can actually trade. My donor can donate to them and their donor can donate to me, which is a great scheme. But that is where I'm at the moment. I should feel really positive about it. I do, but yesterday, hearing that my decline wasn't temporary was quite upsetting to me. It took me a bit of time, and then it was the realisation that, wow, this is getting real. I'm starting to progress, and we've decided, like, ultimately the last thing I want is to end up on dialysis, so we've agreed it's sensible to start this process now, ready for when I need it. I'm not saying I need a transplant tomorrow. However, in light of where my blood results have been over the coming months and how often I'm losing function, we don't want to wait till I need an emergency line putting in to then think, right, crap, we haven't tested for it. So he has said he has grounds now to refer me to a hospital called the Freemans, which deal with the transplants, as well as referring now to one of the specialist nurses that deals with the transplants. People have asked me if I've had anything to do with transplants before. Not really. We have, obviously, I dealt with people in the end stage of the disease, so people either waiting for a transplant that didn't have donors, who were on dialysis in the meantime, or people that were not able to have transplants. And that is a thing, you know, if somebody's got really unstable diabetes and that's going to then affect the new kidney, then they sometimes won't do that, do a transplant, or for various different reasons people are not suitable for transplants. So that is another flip side of it, but I didn't really have that experience with transplant, if I'm really truthful. The other thing as well is patients that were on dialysis would often, especially if they were waiting for a donor, whether that be dead or a live donor or a dead donor, they would literally get a call out of nowhere. So I've known patients be on holiday and they get the phone call to get down to the hospital in I think it's maybe 30 minutes, an hour, and they've been on holiday and they've not been able to go and they've missed that opportunity, so it goes to the next person down. But yes, I haven't got masses of experience in transplantation. I have only dealt really with people who are at the end stage, stage 5, waiting for the transplant, or that dialysis is their only means of making sure they stay healthy. So it is going to be an experience for me, but that is where I'm at the moment. I will carry on taking you along the journey. I am also going to do some promotional videos on blood pressure, because one of the things I think is people don't know the importance of blood pressure and how the kidney affects that. The kidney plays a massive role in it, but I will expand in another video. If anyone has any more questions, please ask. I will post them and try my best to do videos on them. In the meantime, thank you for listening.